Hello, everyone. Welcome once again to another session of ISSUP Nigerian Chapter webinar, tagged ISSUP Nigerian Knowledge Update Series. And for those who have been following us, this is the 19th session. Once again, my name is Martin Abuja. I am the National President of ISSUP Nigeria Chapter. Today, we shall be discussing a very important topic, I must say, which is community support system of care for people in recovery. And to lead us in this session is Fatima Abiola Popoola, and Mark Bishop Uguje will be supporting me in moderating this session. Mark Bishop is the Assistant General Secretary of ISSUP Nigerian Chapter and a member of the editorial team. But before I call on Ejikemen, Mark Bishop, to introduce the speaker, let me also say that attendees here, whatever information that you get from this session, it is not the position of ISSUP or that of the presenter. It is not a medical or treatment advice, but the views of that of the presenter. This is part of our information to let people know that at least if whatever presenter says in the course of this presentation is personally the presenter's professional views. Please let us also remember that in the course of this webinar, opportunity will be given to attendees, to ask questions. Please use the chat box to ask your questions while the presentation is going on. And as soon as the speaker is done presenting, we shall be taking the Q&A session. So at this moment, let me invite Ejikemen to introduce our speaker for today. Once again, thank you for being part of this session. Ejikemen, over to you.
Welcome our presenter today. Our presenter today is Fatima Abiola Popoola. Fatima Abiola Popoola works with the National Drug Law Enforcement Agency, NDLEA, and currently the Assistant Director, Sensitization in the Drug Demand Reduction Department of the agency with office in Abuja. She is a United Nations Office on Drugs and Crime, UNODC trained addiction counselor and master trainer for drug prevention, treatment and care, DPTC. She is also a Universal Recovery Curriculum, URC master trainer for Colombo Plan Drug Advisory Program. Fatima holds a master's degree in guidance and counseling and is currently undergoing her PhD program in guidance and counseling at the University of Abuja. As a researcher, Fatima has presented some of her work at both local and international conferences. For 3 years, Fatima was the Kaduna State Coordinator of ISSUP Nigeria Chapter, and presently the Assistant Zonal Coordinator for ISSUP in North Central Nigeria. She has attended both local and international ISSUP conferences. It's my pleasure to welcome you, Ms. Fatima, as we proceed with the presentation. Thank you. Hello, Ms. Fatima.
Yes, can you see me? Am I here?
Yes.
Yes, we can see your slide now.
Okay. Minimize the panel. Yes, can you see my slide now?
Yes, thank
Good.
you.
Yeah. So, hi everyone. Fatima is here, and this is the golden fish. So, I'll be talking about community support system of care for people in recovery. All over the world, there is this pressure and high expectation from people who use drugs. And this is because our society still views people who use drugs as people who have moral failure, as people who went to substance use on their own, as people who are in the problem they cause for themselves. So there is still this pressure on people who are in recovery. People who use drugs are being stigmatized, they are being discriminated against by people just because of the condition they find themselves. The society still views people who use drugs as people who have moral failure. But research have shown us that, like any other illnesses or diseases, substance use have its own relapse rate, while other diseases too have their relapse rates. And for example, look at this diagram from SAMHSA. The rate of relapse from hypertension and asthma is between 50 to 70%. And we can see from the slide also that the rate of relapse for substance use disorder is 40 to 60%. So what we are saying here is that just as there is relapse in any other illnesses or diseases, it's the same thing with the problems of substance use. So it's not only in substance use that we have relapse cases. So because we are talking about recovery, I will quickly take us through the definition of recovery according to SAMHSA. But before we go into recovery, as professionals on the field, and also as people in recovery, because I'm sure there are people in recovery that are watching this now, we must always believe that anyone can recover from substance use. There is the general belief that, oh, substance use disorder is a chronic disease. Fine, we agree with that. But people who use substances, people who are in recovery, can manage their condition successfully. So to be able to care for people in recovery, we must have that belief in us that the people we care for can recover and they can manage their condition successfully. Also, as people in recovery, we can't believe, and we should believe also, that our condition is not permanent. As a person in recovery, one should believe that his or her condition can be managed successfully and that he can live a successful life. So according to SAMHSA, recovery has been defined as a process of change through which an individual improves their health and wellness, live a successful, self-directed life, and strive to reach their full potentials. This is the definition of SAMHSA. So when one is in recovery, the person is in a process of change. The person is in a process of wellness, a process that is directed towards a self-fulfilling life. Like any life endeavor, you know, sometimes in our life we said, oh, I have my first degree, I'm going to do a master degree, and after then I'm going to do my PhD, a doctorate degree, and I want to be a professor. Sometimes in life, as individuals, as human beings, we can have this kind of plan. But when we start such processes and the reality starts to set in, it is possible that we will get into some challenges that may not allow that plan to be as smooth as we have already planned. So the same thing in recovery plan. The person in recovery might be planning, I'm going to stop drug use, I've been treated, I'm okay, I want to stop drug use, I want to go back to school, I'm going to get married, I want to get a good job, I want to live a life without drug. This might be a plan of somebody who is in recovery. But by the time the person starts the recovery journey, the diagram down is different from the one up. So the one down is the reality of life, where the person can come in contact with obstacles that may not allow him to reach that goal within the stipulated time. So what we are saying here is that for recovery, there is no stipulated time for recovery. It is a lifelong journey, and it's a very long journey. And on the way, the person can come in contact with obstacles that may not allow him to reach that potential at the planned time. But even when the person cannot reach the place at a specific time which the person has planned, there is time to come back. There is time to replan and re-strategize. To make recovery successful, there is what we call the recovery-oriented system of care. And I'm going to be quoting William White, who is a writer on addiction and recovery and policy. He explains that recovery-oriented system of care, he explained it as network of formal and informal services developed and mobilized to sustain long-term recovery for individuals and families impacted by severe substance use disorder. So what this writer is saying is that recovery is not only for the person who is using substances, but it's also for the family and also for the community as a whole. According to SAMHSA, recovery-oriented system of care is a coordinated network of community-based services and support. And this is person-centered. It's not a system that is dictating for the person in recovery. It is person-centered. It takes into cognizance all the challenges that the person has faced in the past and is facing presently. And it also builds on the strength and resilience of the individuals, the families, and the community in order to achieve abstinence and improved health, wellness, and quality of life, especially for those with or at risk of alcohol and substance problems. This is the definition of SAMHSA for recovery-oriented system of care. SAMHSA made a model of recovery-oriented system of care, and in this model, we can see that it's all encompassing, just like the definition mentioned. It is a model that comprises the local community where the person who is using substances resides, the attitude of the community. Remember in the beginning of the introduction, I explained that there is the high expectation we have for people who are recovering in substances, in substance use. We have high expectation that they should be cured. They should stop using the drugs. But our attitude towards them can make or mar the recovery processes. We also see that we have law. The person may have a problem with the law. And media is very important. The message the media portray about people who use drugs is also very important in recovery. Excuse me, please. Also, the culture of the person is very important in recovery. Some people attach so much importance to some kind of substances, and they also see these substances as some kind of cultural activities which they have to, involve themselves in. So in recovery, we should look at this also. Looking at the health services, to make recovery successful, health services must be available for the person in recovery, and treatment must be available at all times. So the system in recovery-oriented system of care is not just a place where we will go. It's not an agency, but it's a macro level organization. It's all the activities that happens within the community that is going to help the person in recovery to achieve a successful and self-directed life. So why are we talking about recovery-oriented system of care? We are talking about this because it is important to support each person passing through recovery to have control over their life, regardless of their emotional experiences. When people are passing through recovery, they are passing through a lot of emotional stress, they are passing through a lot of emotional damages, stigmatization, discrimination. So recovery-oriented system of care will take care of all these. Also, the recovery-oriented system of care see each person as an individual, and this should happen to us too as professionals. We should desist from focusing on the health problem, the challenges of people. We should first of all see them as people. Then we'll be able to care for them. And then the recovery-oriented system of care will be able to be successful within the community. We should also acknowledge individual differences because no two human beings are the same. People have different ages. When people are passing through recovery, the way we treat an elderly person is different. The strenuous exercises that you are going to give to a person whose age is advanced is different from the person who is a younger person. We should also recognize gender. There are people who don't want to be recognized as male or female. We should also recognize this. Also culture, like I said earlier, and other support network. We should also strengthen the recovery person, the family, and the community relationship to the advantage of everyone, because it's not only the person in recovery that is passing through that recovery process. The family is passing through it, and the community is passing through it also. So to make the recovery-oriented system of care work, we must have the belief and intention that recovery is possible, first of all. So when people come back from treatment, we should treat them right. We should forget all the past actions, all those negative things that have happened in their lives before. We should start to look into a future, a brighter future for them, a future with hope. We should also network in the community with other professional services to help the person in recovery. We should foster relationship that support long-term recovery of the individual and their family. And also, the person who is in recovery should connect with the community. Most times, when people are in recovery, we think that they cannot vote or they cannot be voted for. This person can vie for a political office. He can open a business and people should patronize him. So we must have the belief that recovery is possible and it can work for the person in recovery. How do we support the person in recovery? To support the person in recovery requires professionalism. You can be a professional ally, you can be a peer support professional, and you can be a recovery coach. I'm going to explain this as we go on. What are the activities of recovery support professionals? Recovery support professionals advocate for their clients. They stand in for them, they stand up for them. They link them with other resources and share experiences of other people who have used substances with them, good experiences that will make them abstain also. Also, fostering community relationship and building relationship is part of what support professionals are expected to do for the clients. Also, skill building, mentoring, and goal setting are part of the functions of recovery support professionals. Now, as recovery allies, what do we do? Recovery allies are trained professionals. If you are not trained, you cannot be a recovery ally. They support people in recovery, and this position can be paid for, and the person can decide to be a volunteer. The recovery ally is committed to the client. It builds skills and empowerment, and also refer the client in case of emergencies and other health challenges. No experience of drug use is required for a person to be a recovery ally. So a teacher can be a recovery ally, a doctor, an engineer, a parent can be a recovery ally, as long as you are trained as a professional. It is a non-clinical position, and you don't have to be in mental health field to be a recovery ally. For peer support professionals, these are people who have had experiences in the past, who have used drugs and are recovering. These are the people we call peer support professionals. They encourage people who are in recovery, and they explain their experiences, like, I've been there before. This is what helped me. This can be useful to you. So they help people who are fresh in recovery to be able to abstain and live a fruitful life. Also, we have recovery coaches. Like the name implies, coaches are coaches. They instruct, they teach the people who are in recovery. They teach them on different skills on how to cope with the problems of life. They help them to achieve abstinence and encourage resilience and sense of well-being. These services can be paid for, or the person could be a volunteer. The recovery coaches teach, they mentor, they coach, and it's a non-clinical position also. So there are things that we should take cognizance of when we are practicing as either a recovery ally, a recovery coach, or a peer support professionals. These are the positions that cannot be compared or be mistaken as a counselor. If you are a recovery ally, for example, you cannot be a counselor. You cannot be a social worker. You cannot be a psychologist or a marriage counselor or a doctor or a judge. So, for example, I am a medical doctor and I'm a recovery ally. And my client, the person in recovery whom I'm supporting and caring for, is sick. I cannot care for the person as a doctor. I cannot give him injection. What I'm supposed to do is to refer him to the hospital where the doctor will take care of him. I cannot be a lawyer for my recovery person. Assuming I'm a recovery ally and I'm a lawyer and the person has a case in the hospital, I cannot go to the hospital and stand in for the person I'm caring for. That I'm his recovery ally and I'm his lawyer. It is not possible. You wear only one cap as a recovery ally. The person whom you care for is not your roommate, is not your best friend, and you cannot be a spiritual leader as a recovery support professional. So these are the things that we should guide against when caring for people in recovery or when we are in the function of a recovery support professional. When caring for people in recovery, language matters. It is very important to guide our languages and the way we use our words when we are caring for people in recovery. It is important to address people as people, not by their sickness. So these are languages of recovery. Most times you hear people saying addict, alcoholic, abuser. These are stigmatizing languages. Instead, the preferred language should be a person with substance use disorder. Instead of saying the person is addicted to alcohol, the preferred language should be the person has alcohol use disorder. Instead of saying lapse, relapse, those words that we are used to, lapse, relapse, sleep, these are not languages of recovery. The language of recovery is a single use after no use, or a recurrence of use, or a resumed use. So instead of saying Fatima has relapsed, you can say Fatima has resumed use, or Fatima has a recurrence of use. So this is less stigmatizing. For example, a pregnant woman that has a disorder, instead of saying she's a pregnant addict, we can say a woman with substance use disorder, or a woman who is pregnant and has a disorder. It's better than saying she's a pregnant addict. Substance abuse or substance use dependence or substance dependence, instead of saying that, we can say substance use disorder. I think substance use disorder have gained ground and a lot of people have been using that. Also, instead of saying clean, you should be clean, or instead of saying dirty, we can say the person is drug-free. Instead of saying the person is clean or substance-free, we can say the person is testing positive for substance use, instead of saying the person is dirty. So this is just trying to explain to us the language that is preferred in recovery when we are caring for people in recovery. There are challenges of that people, recovery support professionals encounter when they are caring for people in recovery. One, wearing two caps. Like I mentioned earlier, I cannot be a medical doctor and also be a recovery ally to the same person. So wearing two caps is a no-no in recovery. Not practicing detachment. Most times when we care for people, we are overwhelmed with their problem and we involve ourselves so much that we forget ourselves. So practicing detachment is a challenge, and sometimes this happens because professionals want to prove that they have empathy. They have empathy, they want to care, they want to support. And because of this, they involve themselves so much in the problem of the person they are supporting without knowing when to retract. Not setting healthy boundaries. All of us knows what healthy boundaries are. So sometimes we may decide to go into the house of the person whom we are caring for as a recovery ally. Sometimes we see people can go and sit down with them and start eating with them. This is not setting healthy boundaries. This is a professional work. Like I said, to be a recovery ally, you must be a professional, you must be trained. So setting boundary can be one of those challenges that a professional encounters when supporting people in recovery. There is what we call the partnership agreement in recovery. This agreement explains your relationship with the person you are supporting. And each person's function and expectation are spelled out in this partnership agreement. So if this partnership agreement is not clear for both parties, it can bring about challenges during the process of the treatment of the recovery plan. Also, not practicing self-care. Just like not practicing detachment, when professionals are involved in supporting people in recovery, and for example, the client called the recovery ally. For example, I'm a recovery ally now, and my client is named John, and he calls me, Fatima, please come quickly, come quickly. Some people are beating me at the market square. And I stood up and ran to the place. What will happen? I might be beaten together with my client at the market square. So, as a recovery ally or recovery support professional, we should practice self-care. We should know when to rush to a scene to save our client. We should know when to call the law. As I'm going, what is expected of me is to go straight to the police station and report the case and maybe go with the police to the scene instead of me rushing because I love the person so much and I refuse to practice detachment and I didn't even care about myself and I rushed to the place and I start to, why are you beating him? Why? And the two of us have been, we are all in harm's way. Then on professionalism, like sexual abuse, sexual harassment, and other unprofessional acts are those challenges that, some of the challenges really, that professionals encounter on the field when caring or supporting people in recovery. Then for the person in recovery also, there are challenges faced by them also. One, inadequate social and emotional support. Remember when I was talking about recovery-oriented system of care, I mentioned that these are activities, services that are in the communities, from the family, from the friends, from the religious leaders, from the community leaders, from the police, from the health sector. These are services that are supposed to care for the person in recovery. And if these services are not there, if these services are inadequate, they can be a serious challenge to a successful recovery journey. And also inadequate nutrition. we found out that most times people who pass through recovery, people who are using drugs, people who are on the street, they don't have serious means of survival and they may not feel very well. So if they are not feeding very well and they are using medication to survive, then to be able to achieve successful recovery will be very difficult. And also, if there are no outdoor activities, other activities that can keep the person busy, it can be a serious challenge to the person. Also, not adhering to treatment. Sometimes the person may not have money to go to the hospital. The person have doctor appointment every month, and the person cannot go. So this is a serious challenge for the person, and it will disturb the recovery plan also. Also, returning to substance use, which most people call relapse, can also be a challenge to recovery journey. Clients believe about substance use. Some clients believe that this drug gives me inspiration. I'm a musician, and when I smoke cannabis, I get inspiration to sing. So if this belief is still there, it will be very difficult for us to achieve a successful recovery. Reassociating with old friends who use drugs is also a problem. And also, recovery is a long journey. When somebody is in recovery, the person has to be explained to that this recovery is a long journey. It's not a one-time thing. It may not stop in 1 or 2 months. So if the person continues to go back to substance use and the person continues to abstain, the person continues in treatment, and sometimes they return to substance use, it can be very frustrating for the person. And this can cause a serious problem to recovery. So what is the way forward? How do we achieve a successful recovery for the person passing through recovery or going through a recovery? Take a training as a recovery support professional. Everybody is not a recovery ally. Everyone cannot be a recovery coach or a peer support professional. You must pass through training. You have to be trained to be a recovery support professional. You may wish to be a recovery ally. You may wish to be a peer support professional. You can even be a recovery coach. Any of these is okay to care for the people in recovery. To care for people in recovery requires commitment and patience, because you may have appointments with a person in recovery for 3 p.m. and you are there since 2:30. The person is not there by 5. And you are there. You are there. You have put the whole of your mind, to help this person, but the person is not there. It can be very frustrating for the professional. Be aware of the presence of trauma. Trauma is very important when we care for people in recovery, because trauma is a serious thing that can bring about recurring experiences to the person in recovery. It is important for a recovery ally or other recovery professionals to know about recovery. Training to know about trauma. Training on trauma is very important for a recovery support professional, because there is a higher risk of later substance use, and substance use predisposes people to higher rates of trauma. So how do we become a recovery ally or recovery support professionals? There are so many resources online, even on ISSUP platform. This is one of them, the Universal Recovery Curriculum, and that is the textbook there. You can search for it on the ISSUP platform. It's there. It is designed to be a standalone course. Unlike the UTC or UPC, I'm not discouraging any of that. I'm just explaining. It's a standalone course. Once you pass through that, it is only in one series of training. No other courses are required as a prerequisite to be a recovery ally. You don't have to be a medical doctor. You don't have to be a psychiatrist or a psychologist to be able to take the training. There are other documents from SAMHSA on recovery. The one at the center is for peer-based addiction, and the third one is for recovery coaches. All these resources are online and we can access it. So to wrap this up, as a person caring for and providing support for people in recovery, Knowing our environment is important for us to achieve a successful recovery-oriented system of care, because the recovery-oriented system of care is embedded in the community. So knowing our environment is important. Available services that will help the person we are helping is very important too. So as a recovery support professional, we should know about our environment. We should know the services that could be useful for the person we care for. We should also keep a directory of all necessary services to provide needed support for the people we care for. We should be careful not to overstep or force a person to accept our views. Remember that we should empathize always. It's also important to learn more about trauma. Trauma training is important for people who care for people in recovery. It is important to recovery professionals. So we should also remember that our job as recovery support professional is to support the client and to provide other necessary support outside our own functions, to make the person trust us and also to assist them when the need arises. Thank you very much. Hello, am I there?
Yes, you are here. We can see you loud and clear, and we can hear you very, very well. Thank you so much, Fatima, for taking us through this. Indeed, you are the golden fish. Not only a golden fish, you are the golden fish. You have really done so well. I have personally learned so much from this, your presentation. Attendees will agree with me that Fatima presentation was brilliant. For those who may not have asked questions, please use the chat box to ask the questions. At the moment, we still have questions already, and we shall be taking the questions shortly. Fatima, just to be sure that you're still with us. Fatima, can you hear me?
I'm here. Oh,
okay, good to know. Good to know. Of course, yeah, I can understand. There's also the need to at least take a sip of water.
Stop sharing.
Okay, good. Thank you so much. Briefly, before we take the questions, Fatima has made us to have a good understanding of what recovery support system is about. First, she told us about how the society view persons who use drugs, and also made us to understand that the uptake or reoccurrence of substance use, which of course before now is usually relapse, is like most other chronic health conditions, I would say, like the high blood pressure and diabetes and so on. So reuptake or reoccurrence is similar. In that case, the issue of stigma associated with substance use should be minimized, considering that substance use disorder is a health condition. And of course, Fatima explained in details the recovery journeys, and it is not always a straight line, and that, of course, is the truth. That has actually been one of the major challenges, especially with family members or people who use aquatic substances and therapists, you know, because family members or the society want to see it as a straight line, whereas it is usually not the case. So coping with that challenge at times could be overwhelming, especially to family members and the therapist. Of course, Fatima also made us to understand that recovery is more of a network. The recovery process is more of a network, not only that of the persons who have or the person who has a substance use disorders, but also the family members and the community. And of course, talks about the individual orientation goals, in terms of treatment. In some cases, it looks like people who are in recovery should have the same treatment goals. That also puts pressure, on different sides. So what it simply means is that individual approach to recovery. And of course, knowing that recovery is a process, I can go on and on, talks about recovery allies, peer support professionals, recovery coaches, and of course, talks about the language in recovery, which is very important because some languages are stigmatizing and they're also discriminatory in such a way that it hinders the recovery process. And importantly, talks about boundaries, between the professionals or the recovery supporters and the persons in recovery. And of course, just like we know, in the field of addiction or addiction science, there are challenges, challenges from the side of the professionals and challenges from the side of the person who is in recovery. But in all of this, Fatima has been able to highlight some of these challenges, and not only highlighting the challenges, also the way forward, which to me is brilliant, So on this note, I will call on the GKM. GKM, I'm not sure whether you've seen some of the questions. Radolf, if you can also help us with the Q&A session, because I can see there are many questions already in the chat box. But before GKM takes it up, let me also say that for those who have been asking for the slides, definitely we will share the slides. I have shared the ISSUP email address and phone number on the chat box. And I also want to assure you that today or tomorrow, this presentation will also be uploaded on ISSUP Nigerian chapter section of the ISSUP global website. So you will also find it there if you are not able to get it. And for those we already have their email addresses, I want to assure you that we will share the slides with you before the end of today. So Ejikeme, do I beckon on you now to take it off from there? Ejikeme, yes, can you hear me?
I'm having some challenges here.
Oh, okay.
I don't know why the question pane is not showing here.
Okay, that is fine. For the questions I have already, some I have actually responded to, assuring participants that they will receive the training, the presentation. Then for those who are asking of how to or where to receive training, you can also use the email address as shared on the chat box to reach out to us, in addition to the information already provided by the speaker. Some of these materials are actually on ISSUP website, and once you also reach out to us, we'll be able to provide additional information. Okay, let me look at.
It's back.
Okay, it's back. Okay, thank you. So take the other questions from here. Thank you.
It's okay. Thank you, Fatima, for that wonderful and insightful presentation. We have a couple of questions here. The first question is coming from Ndip Simon Akum. And his question is, what are the qualifications of a peer support professional? What are the qualifications of a peer support professional?
I think, can you ask all the questions, or should I be answering it as it comes?
Yeah, just one after the other, because
the answer is right. Okay. To be a peer support and professional, you must have used drug in the past and you yourself are in recovery. That's one requirement. So if you have not used drug before, you cannot be a peer support professional. But to be a recovery ally and a recovery coach, you don't need any qualification. You don't have to use drug in the past. You are not supposed to be in recovery yourself. So to be a recovery ally, you don't have to have to be in mental health. You don't have to be a doctor. You can be a parent. You can even be a teacher. It qualifies you to do the training. So anyone can be a recovery ally, anyone can be a recovery coach. But to be a peer support professional, you must have used drug in the past and you are in recovery yourself. You know, because in peer support professional, they encourage the use of the 12-step programs. And you know that in that kind of setting, you have to be introduced to the group because it's an anonymous group. So the person who is a peer support professional must be a recovering substance user also. Thank you.
Okay. Yeah, thank you so much. Another one is coming from Ibrahim Amidu. And his question is, does a recovery coach attend only to people with substance use challenges, or can they also attend to victims of post-traumatic stress disorder or victims of rape?
Okay. Yeah, recovery coach are all rounders. Their specialty is not only about substance use. They take care of even people who have other emotional problems. They can take care of them. That was why when I was talking, I said, these are coaches. They are instructors. They give people life skills. People who have marital problem goes to recovery coach too, and they give them support also. So it's not only about the substance use. No, they can be a general coach also.
Okay, thank you so much. That's the only question that we have here. All other ones are just comments about the presentation, which a lot of them say that the presentation is very clear and is clearly understood by them. And the others are extending their appreciation for a very insightful presentation. Thank you so much. So,
thank you very much.
Dr. Martins.
Yes, Fatima, definitely we will not end it like this. You know, I've already commented on your presentation earlier on, and you have really done so well. Of course, talking about the different disciplines or the different aspects of recovery supporters, it also buttresses the need for people to have the required training to be able to deliver whatever interventions they need to deliver in the field of addiction science. Over time, people have been engaged in the field of drug demand reduction, you know, doing so many things, which of course is understandable, you know, but this presentation has also brought to the fore the fact that drug demand reduction is indeed evolving, meaning that there are different aspects that before now people don't tend to have a good understanding of. And all of this requires adequate capacity to be able to deliver interventions in different areas. While still maintaining that umbrella field of drug demand reduction, it is also important to begin to look at the subunits in the area of drug demand reduction so that one does not become a jack of all trades and master of none. So this has highlighted different areas that people can, you know, take up and have in-depth understanding of these different aspects and be able to deliver effectively in that area. So I just want to use, I just said I should seize this opportunity to buttress the need for specialization, in a different aspect, because the field of drug demand reduction or addiction science generally is broad, so the more you study about addiction science, the more you know that it is indeed broad, that we need more people on board and need more people to specialize in the different areas. And like the presenter said, it doesn't, some don't actually require too much of long period of training. Few days of training can actually bring you up to speed, in addressing there's some aspect why that is taken as the foundational level upon which one needs to build on. Because in the field of drug demand reduction or any unit of drug demand reduction requires regular update of knowledge. Otherwise, one will be living in the past. So once again, thank you so much, Fatima. Let me allow you to say one or two things while Ejikeme check whether there are still questions to handle before we wrap it up. Thank you. Fatima, over to you.
Thank you very much, Dr. Martin. Like Dr. Martin mentioned, there is need to specialize. We have done a lot of training in different aspects of substance use. We've done UPC. UPC has its own different categories of stages. We've done UTC. This is recovery also. So by the time we do all these trainings, having knowledge of all this training is very important. Having knowledge on UTC has helped me so much. Having knowledge in UPC have helped me so much. And when I started doing recovery, it was just very wonderful and very easy for me. So it's important for us to specialize, really. If you cannot be a treatment person, you can be a prevention person. You can be a recovery person. So let's not be jack of all trades, just like Dr. Martin mentioned. It's important for us to specialize. What area are you specializing on? So when you have all the requisite training in all aspects, you now concentrate on that particular one which you want to specialize on and move on from there. You will find out that you become an expert in that area. Instead of touching this, touching that. When they say, where are the treatment people? You come out. Where are the prevention people? No. Having knowledge about every of these aspects is very good, but specialize on one and know the direction which you are facing. Thank you very much.
Okay, the questions are just pouring in now, and we have this one coming from Grace Sent. Her question is, at what point can a prevention expert be a recovery coach?
Okay. Like I said earlier, you can be a prevention expert and still be a recovery coach. No problem about that. But as at the point, and like I said earlier also, you don't have to be a prevention expert to be a coach. Anyone can be a coach as long as you go through the training. You specialize, you are trained on it. But when you are a prevention specialist, you cannot be a recovery ally. For example, if your client, you are a recovery ally now, and your client needs prevention, for example, in some aspect of his life, you refer him to a prevention expert. Because for now, you are a recovery ally or you are a recovery coach. So you refer the person to a prevention specialist. So you cannot perform the two functions together if you want to assist or support the person in recovery. Wearing two caps is not allowed in recovery. You concentrate to be a recovery ally, a coach, or a peer support professional, despite that you are a prevention specialist, despite that you are a doctor. I hope I answered that question.
Sure, yeah. Okay, because we still have some couple of them to attend to. Yeah. This one is coming from Bolanle Ajayi, and the question is, as a social worker in a university, we also double as recovery support professionals. What can we do?
Okay, it's very simple. You can be a social worker, no problem about it. And you can be a recovery support professional, no problem. But as at the time you are performing the function of your recovery, you know, you have the people whom you support who are going through recovery. Those people who are passing through recovery, whom you are supporting through their recovery journey, you cannot perform the function of a social worker. No wearing of two caps. This is very, very important in recovery. It is very, very cardinal. We must take cognizance of that. You can be a social worker, no problem. Do your function, perform your function as a social worker. Another person will be a recovery ally to that person. Another person will be supporting the person through his recovery. As at that point, if that you are performing a function of a recovery ally, if the person needs a social worker, home visit, you are not the same person to visit him. Another social worker should visit the person, not you.
Okay.
Thank you.
This came from Louis Mado Boata. And the question goes, please, can you shed more light on the point or on the fact that recovery coaches and recovery allies cannot be counselors or doctors?
Okay. It still boils down to the same answer. If you are a recovery support professional, you cannot wear two caps. You cannot be a counselor. If you are supporting me, I'm a recovery person now, and you are supporting me through recovery. I've mentioned all the function of a recovery ally, the coach, and the peer support professional. Those are the functions that you are going to perform. You are there to support me. When we say somebody is an ally, somebody whom you confide, if you have a problem, you call the person and the person is there to support you. But when the person comes, the person is not telling you, Fatima, why did you come here? You know, this is a very dangerous place and you are here. You know, you are not saying that. You are there to support the person, to remove him from that environment and hand him over to the counselor that will counsel him.
Okay.
The person needs a house, is jobless. You can refer him to an employment agency. And alongside that, remember, he may still need to get his medication from the hospital. You will remind him, remember, tomorrow is your appointment date at the hospital. You remember, or you can call on phone. Hello, Fatima, have you used your medication this morning? Oh, thank you. You know, that kind of a thing. Those are some functions of the recovery ally, not a counselor, not a priest, not a doctor, and not a therapist. Thank you.
Okay, just to put a cap on that, what is the difference between a recovery coach and a case manager?
Okay. A recovery coach, like I mentioned, is a coach. He instructs. He instructs you, he gives life skill, he directs the person, oh, these are what is expected. If you want your marriage to work, these are what you should do. But a case manager keeps record of everything, every services, and refer the person to all the services that the person needs. So these are slight differences between a coach and a case manager. And remember, a case manager is not a counselor. A case manager is not a counselor. And just like a coach is not a counselor also. So a case manager he has directory of all activities and he refers the client.
Okay, one question just dropped in now, but before that one, we have this Peter Adeni reminding people that they're training on URC, organized by Sanmai, training provider for Colombo in Lagos. So people can really training if you want to become a recovery ally. Then lastly, can someone who has received UTC certificate in basic counseling skills work as substance use counselor or recovery coach? This is coming from Adejoke Jeoba.
Yes, you can work anywhere you want to work. You can work as a recovery coach, you can work as a recovery ally, you can work as a counselor. The only thing is that the two functions should not meet. You cannot perform the two functions at the same time on one person.
Okay, thank you so much. From Adedoyin Omiriji, as we wrap it up, asks a question and says, where can we meet or see people who need recovery so that we can help them?
Oh, people who are in recovery are everywhere. All the people we are treating at the hospitals, at the rehabilitation centers, they are all in recovery. You see, the problem is when people leave treatment, we think that is the end. There are other things that is beyond treatment, and that is the recovery journey. So the people who have passed through rehabilitation treatment, they are in recovery, and these are the people we should be caring for. Thank you.
Thank you so much. That's the size of the question we can accommodate for today's webinar. So I'm handing over to Dr. Martins as he wraps it up.
Thank you so much, GKM, for the excellent moderation. Once again, Fatima presentation was very insightful with a brilliant response to the questions. Fatima, we should be rounding up in just a minute or two now. Some may actually be wondering, these different specialization in the field of addiction science and so on, they keep coming up every now and then. That is to say that people are really at work when it comes to the field of addiction science, bringing out scientific evidence as to what works better. You also agree with me that before now, people who are in recovery or people who are undergoing treatment for substance use disorders are hardly involved in formulating policies or developing treatment interventions and so on. Some of us may have heard it when we talk about it is not about us without us. Some may have heard it. It is not about us without us. People sit down, people who have never had a taste of any of the psychoactive substances, develop policies, treatment strategies, and so on, without hearing from those who have been in that journey. But the field of addiction science has also made it important that we also listen to them and more like feed their pulse and what works better. And that is leading to some of this evolution in the field of addiction science, so as to look at the different components where interventions overlap, what are the consequences. So that is what we see in this process, and that is what the speaker Fatima has been able to explain in details how counselors, for example, cannot perform the same duty of a recovery supporter for a particular client. That is not to say you cannot be a counselor, you cannot be a prevention expert or so, but when it comes to a particular client, where do you draw the line so that you don't perform opposing roles that may even complicate issues even for the client and minimize treatment or recovery outcome. So I think that is what we have been able to look at. It has really been a very interesting session. And I want to say, Fatima, I think we should be bringing you back soon again. The attendees want to hear more of you. So at this point, once again, thank you all the attendees for finding time to join us today. Please let us look forward to another interesting session of ISSUP Nigerian chapter by monthly webinar by November. And to ISSUP Global, we are indeed grateful for all the support towards the hosting of our webinars. And on behalf of the Executive Council of ISSUP Nigerian chapter and the Board of Trustees, I say thank you all for being part of today's session, and bye for now. Thank you.
Thank you. Bye-bye.
Okay. Bye.
Thank you. Bye.
Okay. Bye.